Hey folks, welcome. This is the next video in our pain series. This is neck pain part 2. Now if you came along for the ride on the first video, you got to see us talk about the anatomy of the neck, different symptoms of neck pain, when to get help, and different kinds of specialists and diagnostic tools. Today we're basically just going to lay down different types of neck pain. Not necessarily doing a deep dive into each of these, but we just want to present the different types of neck pain. If you come along for part 3 after this, we're going to talk about different therapies, medication, home remedies, which would be of great interest to many of our followers out here.
It's going to be really good.
And prevention, which is, for us, the most important. We'd love to help you after you end up getting hurt, but we'd rather you not get hurt in the first place.
Right.
We are the FitHealth Pros. I am Coach Sean.
And I'm Dr. Kevin. And so let's go ahead and get into the types of neck pain, part 1A, since there's many, right?
Yeah, there's a lot.
All right.
There's a lot.
So one that I deal with a lot, and I think you do as well, is muscle strains. And that's where you have an overuse of the tissues, possibly due to prolonged reading, driving for long periods of time, electronic use. I think
lots of electronic
nowadays,
use.
what are they calling this thing? Text neck.
Yeah, we're getting text neck. We're getting all kinds of iPads and computers and hunching and all these going right up into the neck.
Yeah. The other thing we may see from a strain, you could kind of get that from an exercise that has a quick twisting motion.
Sure, especially if you're not warmed up.
Sleeping wrong. I'm even going to add to that, sitting on the couch watching TV at an angle. Maybe people who are working at home. I think that's timely. Maybe you're not in your ergonomic workstation. You're in a kitchen table or something that's different.
Or sitting on the couch with the lap.
Yeah. So
you know,
a lot of times it's the neck in an improper position. It's looking down or looking to the side. So that's muscle strain. Another one's going to be nerve compression. And what happens there, and we're talking about the nerve roots that come off the spinal cord between the holes in the vertebra. And that compression is going to be due to either a herniated disc, possibly bone spurs. It can come from degeneration too, which we'll talk about in a second. But if that vertebra gets closed down, the hole gets smaller, which then can compress the nerve. Yeah. And it's interesting because you don't necessarily feel the pain at the nerve compression because they don't have the pain sensors, but you feel it either, it goes down and away, so you feel it at the end, or you feel it at the herniated disc, or at the facet joint, so within the vertebra. So that's where you feel that pain. We've gone into that actually, I think, in our other pain series videos, talking about those pain syndromes and where they come from. A couple types of arthritis that can cause neck pain. There's osteoarthritis, which is going to be the more common arthritis, and that's going to be your bony, bumpy kind of thing that you see on an x-ray. It is something that, if you can relate it to maybe the knuckles where they're bigger, that's an osteoarthritis type of arthritis. Now, what that does is it has inflammation. It's osteoboneitis, inflammation, so bone inflammation. And then we compare that to rheumatoid arthritis, which you can have, and that can cause neck pain as well. The difference here is rheumatoid affects the immune response. It is a systemic disease, usually diagnosed with blood work versus an x-ray.
Sure.
Okay, so again, swelling of the joints, no fun. So those are your arthritises. Then you have osteoporosis, and that's the one that can weaken the bones. It can cause small fractures. It's about bone density here. So that's osteoporosis. We don't want that. There are many ways to help these things, and I think that's what we're getting into with video 3. So
Yeah.
as we go through these, because of course Sean's going to do more types of symptoms of neck pain.
That's right.
But if you have any questions, or if you're identifying with a type, give us a shout out. Let us know, and we'll answer the question for you. Who knows? We'll probably have a deeper dive into each one of these things because we want to help everybody that has different things.
Yeah, it's part of why we're doing this channel is to see what people need. You know, we're kind of throwing, with videos like this, we're kind of throwing a bunch of stuff out there and defining it for you. So you can kind of maybe put a finger on it for yourself, or as something that you can ask your chiropractor or your other specialist. Could this possibly be what's going on with me?
Right.
You know, that's why we're here. Next up is more types of neck pain. First one I want to talk about is the neck pain associated with a heart attack. Now this is a classic symptom that can go along with some of the other ones. There's actually a pretty long list of symptoms when someone's going through a heart attack. You could get nausea, you could have shortness of breath, you could vomit, you could have the sweats, and you could have the arm or the jaw pain kind of radiating down. This also includes the pain that could go into the neck as well. That could be a warning sign that a heart attack is coming, or that you're in the beginning stages of a heart attack. So if you do have all of this going on, get help immediately.
Absolutely.
Next up, I want to talk about meningitis, which is an inflammation of that thin tissue surrounding the brain and the spinal cord. Some of the symptoms here, in addition to neck pain, would also be fever, possible pounding headache. So if you have a headache that just will not go away and it is directly associated with a fever and or severe neck pain, again, get that checked out immediately too, because meningitis, if left unchecked, can be fatal. That's a bummer.
Yeah.
That's, you know, some of these things that we go through, it's just too bad when you think about the people that are going through these specific types of pain. It's horrible.
And meningitis isn't that popular. It's going to be one of the smaller percentages of people that have neck pain. But we are trained, or I, you know, as a chiropractor, when I went to school, and what the board regulates us is to make sure that we don't just go right into our treatments, that we're asking you questions on your history to maybe root that out. Because, and it's once or twice in my entire career doing this that we've had to refer out. And luckily with my office, I was real close to an emergency center, so that helped those patients tremendously because we could just walk them.
You need to
Yeah,
have
we can walk them down a sidewalk now.
Yeah.
But again, it's not a high percentage, but know that you know, a high percentage of people have neck pain, but not a high percent have meningitis or these serious things. But what that means is when you go to the medical doctor, you go to the chiropractor, or you go to the physical therapist, and you say I have neck pain, hopefully they do a background and take that time to give them your history, and don't go for the quick crack, because it could be a bad thing, but most of the time, you know, we're going to find the cause of the pain.
Looking to get a little deeper into the cause of the pain so that you can be treated,
Right.
you know, specifically for what's going on. Next up, we're going to talk about fibromyalgia. Now, fibromyalgia causes muscle pain throughout the body. I do have a client right now that has it, and it is a bear to kind of get your arms around and figure out a way to tamp down that pain when the inflammatory response is going on everywhere. It can go from system to system, and it's just really tough. But it is really common in the neck and shoulders itself. It can present in other areas of the body as well. But that's why we're bringing it up here in this neck pain series especially. Last one I want to talk about before we get to even more types of neck pain, which Dr. Fox will take care of,
Yes.
is spondylosis. Now, spondylosis is a cervical disc degeneration over time. Now, what happens with spondylosis is that space between the vertebrae start to narrow and causes that compression of the nerve roots
Yes.
right there between the vertebrae. So, you can talk a little bit about spondylosis?
Cervical disc degeneration, I can compare it with stenosis when I get over there too.
Oh, perfect.
Yeah.
That's great.
Yeah. So let's get into even more
Exclamation
types
point.
of neck pain. And that's how it's written.
It is.
Injuries. So, of course, you can have injuries to the neck, but you can have injuries that affect the neck. So forces outside that normal range of motion. So think that, a car accident, a whiplash, any straining of those soft tissues can definitely cause neck pain. And as little as 8 to 10 miles an hour can cause neck pain. So why is that? Well, it's all about acceleration, deceleration. So we'll probably do a deeper dive on that video too, just auto accidents.
On auto accidents and whiplash itself.
But because it's neck pain, if you were in a little fender bender and you had neck pain and you came to, kind of listen to this one, the auto accident, it doesn't take much. Don't let insurance companies tell you that, oh, there was no damage to the car, there's no damage to your body. That is false. It's not scientific, and it's not physiology, and it's not physics. So keep that in mind. So there's that injury aspect. So sports, diving, auto accidents, roller coasters.
Yes. Had that with my partner one time. We were celebrating me kind of spreading my wings into my own company, and very first ride we went on in Magic Mountain,
Yes.
whiplash.
No fun.
The rest of the day was, maybe we should go.
I know. That's why they have you sign all those release papers. All right, so another type of injury that can cause pain is the herniated cervical discs. So the herniation, think of the disc like a jelly donut. As the head moves back and forth, or the weight or the posture is changed, if your head moves one way, the jelly's going to move toward the outside. But if you have an injury to the disc already, that thins out and that can bulge or herniate and protrude into the space there. And what that does, it irritates either the spinal cord, irritates the nerve root. And so it can be from trauma, injury, overuse, improper posture over time. A lot of these injuries and pains, it's not the pain that just, oh, I woke up and I did this wrong. It is something that's happened over time, and now you just are feeling it. So keep that in mind. So spinal stenosis is the narrowing of the spinal canal due to long-term inflammation.
Inflammatory response.
That's an inflammatory. Spinal stenosis we see very common, more in the low back.
Okay.
But we just had some patients that had mild to medium, minimal spinal stenosis in the neck. And it causes pain. Unfortunately, the adjustment doesn't take care of that. The inflammatory process, think of, again, and we'll get into it next video, think of the things that you can do to take the inflammation away. And let's try to go away from the obvious, which is either a steroid or taking ibuprofen or Tylenol all the time, because that'll do it short term, but there's negative side effects to that.
Right. How can you do it more naturally?
Right. And compare that, so, and I mentioned the spondylosis that Sean talked about, which is cervical disc degeneration. So if you picture the discs being a cushion in between the blocks, if those discs dehydrate, they start to shrink and deflate. So it's not a compression, it's just over time. And the key here to keep them pumped up is to use it. So why is it decreasing? Well, there's usually loss of the neck curve, and just within that, you don't have to have symptoms with loss of a neck curve, but it creates the spondylosis and other issues. The narrow spacing between the vertebra, so that's that. So stenosis and spondylosis, one's going to be narrowing on the outside, the other one's going to be the narrowing of the cord, where the spinal cord comes down. So some other conditions, infections, tumors, abscesses, even cancer of the neck, any of those kind of congenital abnormalities can be a factor as well. So whether it's any of those type of things, abscesses, cancers, tumors, congenital abnormalities, kind of look at the neck, see what it's doing. If it's tilted and there's a lump coming out of the side, have that checked. If it's a small P up under the jaw, have that checked. All of those things are now checked with our normal evaluations called palpation. So if you're going to a chiropractor or anybody and you have neck pain, they should be checking not just back here, but checking the sides, even your jaw. So that's what should happen there. So even more types of pain.
Wow.
Yes.
So we had types of pain, more types of pain, and even more types of pain. So as you can see, there's quite a bit of, there are multiple neck compartments with the vertebral, the vascular, and the visceral within the neck. So because of that, each of those compartments can have a different type of pain happening. Many different types of pain happening. So we touched on a bunch today. There are more. I mean, it's crazy with the amount of mobility that you have in the neck, side to side, all the way around and back, gives you much more of an opportunity for injury. So hopefully you like this video, and you can hit the like button, you can hit the subscribe button to get even more of our videos. Every time that you like a video, every time that you one time hit that subscribe button, hopefully, yes. Or odd number of times, as we've talked about in other videos, jocularly, you're helping us help more people. So we would love for you to, if you really get some benefit out of any of these videos, and especially out of neck pain part 2 that we just did, please hit that like button for us. If you missed video 1 we talked about the anatomy of the neck, symptoms, when to get help, different types of specialists, and the diagnostic tools that they might use. Go back and please watch that. If you're with us now and you're going to continue into video 3, video 3 is going to talk about therapies, different medications possibilities, home remedies, and prevention. So that's going to be a really important video. That could be the most important video of this 3-part neck pain series within the pain series overall of the FitHealth Pros, because that's who we are. Right. We are the FitHealth Pros. Yes. I am Coach Sean.
And I'm Dr. Kevin.
And we just love to have you with us. Thank you so much for joining us on this ride. And continue.
Yeah, we'll see you on the next one.
Thank you much.
Should we do
click
who we are?
Oh, yes.
Is there something else I can help with?
Oh, no.
No. Thanks, Siri.
Siri, what happened? All right.
I can read a whole lot of nothing. Does that count?